It is, in fact, an absolute delight to be here this morning at this auspicious occasion where we are launching this very important initiative, the African Medical Tourism Council in Ghana. In fact, today marks a very significant leap for us as a country in our commitment in advancing health services in Ghana and position our nation as a beacon of medical excellence on the African continent. If you all listen to His Excellency the President on Tuesday night, at the maiden awards night of the Ghana College of Physicians and Surgeons, he repeated this. And he said that with the construction of 111 hospitals throughout the country in all the 16 regions, popularly known as Agenda 111, Ghana is on the path to become the medical excellence hub in Africa, especially after COVID. The African Medical Tourism Council is not just an initiative, but a testament to our dedication to fostering a robust or inclusive world-class health system, especially in the sub-region. It is estimated that about 60,000 Africans from the West Africa sub-region alone travel abroad for healthcare each year, with an estimated $6 billion United States dollars spent on medical tourism from the entire continent. With about $1 to $2 billion United States dollars of that money is from West Africa, especially from Nigeria. Ghana already attracts some medical tourists from the sub-region, but it is uncoordinated and the exact numbers are not known. Designing and implementing a more organized and comprehensive medical tourism system for the country will significantly increase the traffic and direct foreign currency inflow from the source. In fact, we cannot do any proper tourism without medical tourism. The endeavor which we are doing now will also boost the tourism industry in the country. But I will pray that the tourism industry people who are here will try to reduce the cost of air flights into the country. That's what everybody is complaining. And then the hoteliers also here will reduce the price of our hotels. Because we are in a country where 4-star hotels sometimes cost nearly $100. It's not the best. There are some places where they charge 1,200, 2,000 Ghana cedis. And people who are coming to the country are complaining. So let's reduce it. The global medical tourism market size is valued at $60 billion US dollars, and is expected to grow over 200 billion by the year 2030. Some countries actively promote it as a key economic growth strategy with significant government support. The benefits a country derives from medical tourism, therefore, is not only financial, but it can include the following. 1. Medical tourism tends to elevate the standard of healthcare in whatever country it is practiced. It allows the healthcare industry or facilities to practice international standards of healthcare delivery while increasing the availability of advanced medical management. This higher standard eventually percolates through the entire health system. 2. Medical tourism encourages a more focused, patient-centered approach to care. We must aim to provide health services that do not only meet people's basic medical needs, but also prioritize their comfort, accept their cultural sensitivities, and provide overall satisfaction. 3. It also attracts foreign infrastructural investment in the form of the building of world-class medical facilities and the acquisition of cutting-edge medical technologies. Finally, medical tourism attracts highly skilled medical professionals into the country, allowing training and capacity building in areas of care which is not already available in the country. Ladies and gentlemen, the African Medical Tourism Council, I understand, is already in talks of international partners to provide both equipment and skills transfer that is going to help nurture the competencies in different areas of medical specialties, allowing us to develop a highly skilled specialist workforce over a number of years. Whatever the African Medical Tourism Council seeks to do is to help promote a more organized medical tourism industry infrastructure within Ghana. And I wish to assure you of the total support of His Excellency the President and the entire government in this initiative. In fact, medical tourism is one of our policy directives in 2016, and we are happy. That's the reason why the government looked for more funds to complete this infrastructure that we are sitting in. Also pumping in more funds to start medical tourist centers and centers of excellence across the country. I'm happy to tell you that the urology center in Kolebu is almost completed. And by the first quarter of next year, it should be commissioned for the use of these people of this country. The African Medical Tourism Council goals align seamlessly with the vision of this government for healthcare system that is accessible, inclusive, affordable, and of high standard. The government's initiative is to improve our public training hospitals to become centers of excellence, like the new urology center, as I said, at Kolebu Teaching Hospital, the new maternal and children's center under construction at Komfanochi Teaching Hospital, and other quasi facilities, like the one we are sitting in now, the University of Ghana Medical Center, the Bank Hospital, the International Maritime Hospital, to just mention a few, to become a national medical tourist centers. Government is also very pleased with the initiatives of the private sector through the African Medical Tourism Council for Ghana to go into medical tourism. So at this juncture, I think the public and the private and quasi-private organization should all work together. And we believe that to achieve this, we should first use the scarce resources that we have here. And we believe that the best way to go about this is to appoint consultants, not only in one hospital, but consultants in different hospitals. I'm happy to say the Bank Hospital has started that initiative and has already drafted an agreement for Kolebu to look at it, so that Kolebu can appoint some of their consultants to work formally in Bank Hospital, in Maritime Hospital, University of Ghana Medical Center, and also use our diasporians to also come home, to come and spend some few weeks here with us to do cutting-edge operations and management in these hospitals, so that we can make full use of our hospitals that are scattered in this country. And the private sector, the same thing. We want to also work with the private sector to also achieve this aim. Ladies and gentlemen, I think the key operative word in our discussions here this morning is to organize. Why should we ensure that the medical tourism model we adopt here in Ghana is well organized? It is important to appreciate that while medical care is delivered in individual health facilities, medical tourism reputation is usually country-specific. A country known for providing medical tourism services usually will have a number of facilities that deliver exceptional care. These facilities, ladies and gentlemen, focus on specialist service as well as well-resourced with advanced technologies, having acceptable ambience that caters for holistic care of the client, and provide exceptional customer service. The country has to make sure that we have the hotel facilities in this country where the carers can also have the care that they need. It is the work of these facilities that build the reputation of a country. That's exactly what we want to do in this country. Because reputation and word of mouth plays a very significant role in the growth of medical tourism. Every effort, therefore, should be made to make sure that the journey of the medical tourism in Ghana is seamless from point of arrival at the airport through the care processes till the patient leaves the country. If every health facility designs and monitors its own processes, different foreign patients will have different experiences from different facilities, and therefore resulting in a reputational damage to the national effort. That's why we should all come together. Both the health facilities and then the tourism industry should come together, in addition to our airports, to work closely together so that there will be one system in place for everybody to follow. And we should make sure that whatever University of Ghana Medical Center is doing, whatever Bank Hospital is doing, whatever Bethel Dental Hospital is doing, should be the same across the country. And more importantly, there should be a desk at the airport where the tourist industry will be receiving these patients and then taking them to the various hospitals. And we should also work together, closely together with our embassies in these countries so that they can ease their visas or give them visas on arrival. And if we do all these things and we work closely together and organize ourselves very well, we will be the center of excellence at the medical tourist hub in West Africa. Ladies and gentlemen, the role of African Medical Tourism Council is to ensure that whatever hospital a foreigner receives care, they can return home with good feedback that encourages other people to come here. This is how we can systematically redirect some of the patients going into Western and Asian countries to Ghana. The benefits of organized medical tourism architecture for Ghana will include the following. 1, processes of care are predictable regardless of whether you are in Kolebu, International Maritime Hospital, UGMC, or Bethel Hospital, or any other hospital that is in this medical tourism industry. 2, in each case, the care process is modeled in such a way to allow the country Ghana to put its best foot forward. The reputation is upheld not damage, and the client likely to speak about a delightful experience in Ghana. The African medical tourism, therefore, will collect data on feedback and provide advocacy for those post-operative challenges. 3, the hospitals are also able to charge the right fee for the care provided. Many hospitals in Ghana don't even have differential fee for foreign patients, leading to loss of revenue to the country. And 4, the immigration requirements, hospitality, and other associated services are all streamlined to ease the patient travel to Ghana. 5, in an organized system, it is possible to be sure that the right physician and surgeon with the appropriate complement or specialist skill from the right facility is delivering the care to the client. So if you are a hospital that you don't do what the patient is coming for, you quickly give the patient to the other hospital. And all the facilities that are involved in the medical tourism can work collaboratively to bridge gaps in care and to improve outcome. Ladies and gentlemen, through the essential work of the African Medical Tourism Council, working together with their key facilities in Ghana to promote medical tourism, one would anticipate that within the next 5 to 10 years, we will begin to see increased traffic of patients from our sub-region especially, and more importantly, from the whole of Africa, and also improvement in healthcare service delivery within the country. Because our medical students, our nursing students, and everybody will get access to whatever care is being done in this hospital. And then you create jobs for our team youth who are looking for jobs to do. On the trajectory and beyond, I would therefore expect that in the next 10 to 15 years, many of the gaps that is responsible for Ghanaians traveling abroad will be closed. As we embark on this important journey, ladies and gentlemen, let us remember that the success of the council in Ghana depends on our collective cooperation as health professionals, healthcare industry, both public and private, tour operators, government agencies, and broader community. Together, I think it is possible. We must be determined to realize a future where Ghana stands tall as a hub of healthcare excellence in the sub-region. Ladies and gentlemen, I think the African Medical Tourism Council is possible in Ghana. And on this note, I formally say that I'm inaugurating or opening the Ghana of the African Medical Tourism. So the African Medical Tourism Ghana is fully launched. Thank you very much.